Welcome to the Attorney Talk Podcast, sponsored by Schaeferman Lakin with your host, Sam Gaylord, disability litigator in the state of New Jersey. In each episode of the Attorney Talk Podcast, Sam has casual conversations about the law with varied professionals throughout the legal industry. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, schaeferman.com. Now here's the host of Attorney Talk, Sam Gaylord.
Well, welcome to another episode of Attorney Talk, casual conversations about the law. I am your host, Sam Gaylord, disability litigator in the state of New Jersey and partner at Schaeferman Lakin, representing injured workers in the areas of workers' compensation, Social Security disability, and disability pension appeals. And today I have the great pleasure of having my friend and working colleague, Dr. Nirav Shah, joining me. Welcome to the show, Doc.
Hey, thank you so much, Sam. I appreciate it. Appreciate the time.
Oh, absolutely. My pleasure. Dr. Shaw and I have known each other for quite a while. We've had the opportunity to out in personal events, as well as I've had the privilege of having Dr. Shaw serve as an expert. And I just wanted to bring you on and so what we're trying to do is have clients and colleagues just get a sense that we're attorneys and putting our pants on one leg at a time. And I'm presuming that the doctors do the same thing. So,
Yeah.
So anyway, so I wanted to get started. And one of the things I like to do, just sort of break it up a little bit, is to ask the question that if you could describe something to our listeners that people may not already know about Dr. Nirav Shah.
Well, it's a loaded question for sure, and I do appreciate that.
It's a G-rated show. G-rated.
I hear you. Well, one thing I think that's maybe obvious based on what is written there under my name is I am a brain surgeon, neurosurgeon, and spine surgeon. What I think really humanizes what I do and really keeps me grounded is people don't realize that I'm also a community activist. I really get involved in the community. I'm a coach for a number of leagues and my kids' teams. I love just interacting with our local community in Mercer County and in Bucks County. To me, infiltrating those areas really gives me a sense of satisfaction of giving back to the community I live in that gives me so much joy and I'm privileged to be part of. So, that's really something I'd like to convey.
And I have to agree that I've seen Dr. Shaw at any number of events, and it's one of the reasons that's why I do what we do, is because it's all about that things are good, and if things are good for me, then I have the ability, then I have the capability to provide to others as well. So thank you for joining me. I appreciate it. And I wanted to get started. I know it says neurosurgeon, but can you tell us what does that really mean? You said I work on brain and spine and all that good jazz, but what does it really mean to be a neurosurgeon?
Well, essentially, I'm a brain surgeon. I do surgery on people's brains. I also do it on their spines. And, I know there's a lot of cliches out there about that specialty, but in general, what that means is I went through a pretty extensive, long education course, not just college, but med school. And then after 4 years of med school, something called a residency, which is a extended training where doctors learn what they're going to be. And some call it boot camp. Some call it, some other terminology. But
right.
The reality is it's a very intensive 6-year program where I did at the University of Maryland, where I learned how to operate and treat patients' brain and spine problems. And that's what I do on a daily basis.
So what that really means to everybody who's listening is that Dr. Shaw had larger student loans than your average bear.
That's right.
Basically what that means.
Yes. And that's why I'm still working for a little while.
Right. For a little while longer anyways.
Yeah.
Right. What prompted you to go to medical school?
Yeah, it's a good question. I had a lot of good influences in my life, mentors, one of which was my older cousin, much older than I am, who was a cardiologist in Pittsburgh. Actually got an opportunity to rotate with him, but he was very friendly with a very famous neurosurgeon that resided in Pittsburgh. His name was Peter Janetta. He pioneered a number of surgical procedures for the brain. And I had the opportunity to meet him, and he was a very influential person in that regard. And, from there, I was very fascinated with the neurosciences when I was in college, taking neuroanatomy and neurology type classes. Science really intrigued me. I wasn't really particularly good at math or social studies or Spanish or anything else, but sciences really, really, made me interested. And so, I was from there. I matriculated in a I was so interested, believe it or not, that there are actually programs that allow you to apply to medical school and get accepted to medical school while you're in high school. And in my case, that's what I did.
Wow.
And so they have a combined 6-year BS, Bachelor of Science, medical degree program with Jefferson Medical College in Philadelphia and Penn State University. And so I was able to matriculate through both Penn State and Jefferson in high school. So just imagine, 17-year-old, skinny, wiry kid, had no clue about the world at all, just in my little cocoon. And then you're out there interviewing with doctors to try to get into medical school.
Wow.
Of course, you have certain grades and scores and all that. But, once those are, those criteria are met, you can get the interview. And then I was able to, I guess, turn enough heads to be able to get accepted. And then I started at Penn State University in 1993. Incidentally, the year of a number of great things happening at Penn State. Number one, I think they should have been number one that year in college football. That was the year of Kyle Brady, Kerry Collins, Kajana Carter. That was a huge, huge thing. And in fact, back then we could even play basketball with those players. I used to play with Kajana Carter all the time. And so, I was there only for 2 years. It was an intensive undergrad program, and we got to work through the summers. In fact, organic chemistry was my first class in fall. It was crazy, so I came in with some credits, and I was able to do that. Got through in 1995, I started at Jefferson. And then from 1995 to 1999, I was in medical school in Philadelphia at Jefferson, where I had the opportunity to rotate with a number of neurosurgeons. You get exposed to a number of different specialties, but the neurosurgeons are the ones that I really gravitated to. They not only worked hard, but they played hard too. If these guys were, they would be wearing their scrubs, come do some surgery for 10 hours, then go to the bar and hang out. It was just a cool group of guys who, and women actually, and really interesting people, smart people, hardworking people, caring people. And I was like, that's what I want to do. And
nice.
So I was able to matriculate then from medical school to residency at the University of Maryland. And from there became a neurosurgeon in the year of 2005.
Very cool. Well, I'm going to jump in on a few things because you're first of all, as a 17-year-old wiry kid, to say you're doing interviews with doctors, you're very humble about that. Oh, I had to meet some criteria. It's not like, oh yeah, I had that PE and health class checked off. I'm sure I had to meet some criteria probably meant that the scores were out the wazoo, the grades were out the wazoo. So you're being very humble when you're telling us that you had to meet some criteria.
I mean, they're pretty rigorous, but but that's some of it. I'm trying to think about that time because I remember how painful studying for the SAT was, and how painful trying to do AP classes in school, and just nuts.
It's great because I know that you're a huge sports fan. We've had the opportunity to go down and watch an Eagles game, so I know that you're
a Philly guy through and through. Grew up, raised. Born, I grew up right outside of Philly in Montgomery County, so I'm a local guy. I really, honestly, that's part of why I want to give back to the community, because this is the community that raised me.
Yep, fantastic. So now, and you run your own show now, right? I mean, you're the medical director of Princeton Brain and Spine, which is located in several areas in New Jersey and Pennsylvania, right?
Yeah, exactly. I started my practice in 2005 with Mark McLaughlin. He's a neurosurgeon in the area. Ironically, this is where this is all connected, and I'm sure there's a higher force in play here. But Mark, my partner, trained at the University of Pittsburgh, unbeknownst to me, under Peter Janetta, who was one of my influencers. And I randomly ran into Mark, and he and I started the practice. He actually started the practice in March of 2005, and then I followed suit in August of '05. He was the initial medical director and leader of the group for the first 10 years. And then in 2015, I took over as the medical director, which essentially means I'm running the operations, the general operations of the practice, in addition to my clinical responsibilities.
And has that impacted your either enjoyment for the medical profession or enhanced it?
I think it has. It's a tough road trying to wear two different hats, administrative and doctor. But I can tell you, having good, solid partners who you can trust and who can take on some of the burden really helps. I mean, these guys are lifesavers. They understand my role and my value. I understand theirs. And we work in a really, symbiotic relationship that allows me to lead where I need to and take a step back from clinical activity when I need to in order to for the greater good. And right. I think that's really been it's like a marriage, and so I'm sure you're well aware of all that. And
yeah,
I understand, partnerships are that. And if you have a good marriage in anything, you owe your success to that person or those people,
100%. And it's interesting because I've always gone with the sort of taste test that, it's when you go out to dinner with the person who says, oh, you had 2 drinks, I had 1. Yeah. And then what I'll do with that person is I just take the whole bill and say, you know what, you get the next one. And then there'll never be another dinner.
Right. Exactly.
Because I agree. It's like you go out, you want to be with people that you enjoy being with, and you get that sense. And it was always for us, at least for me, it was the money conversation always was the critical one. Understanding how people view money and how that impacts not only your business, but also how you're going to get paid and how does that affect your life outside of your working world, to get a real understanding of those things as a base. So that way later on, there's not like that hidden, like, oh, I can't believe he's doing this again, or I can't believe he's doing that again.
Right. Exactly. I mean, no one ever truly says it, but money does drive a lot of all your, what you're doing, your relationships, how things are going. But it's I always harken back, and I'm a big movie buff too, is The Godfather, and what was that older guy's name? The older Jewish gentleman that ended up getting assassinated, but he always made money for his partners, and so in the end, like if you're running a sound business with good business principles, ethical principles, and you're successful in that, people will follow you. And that's what I've been able to do here, I think. And again, without my partners and the administrative staff that I have, it certainly would not have been possible.
And I have to say that as you were talking a few minutes ago about just your entertainment and wanting to be a neurosurgeon, you want to be with those cool guys, you were totally geeked out, man. I mean, I was watching you, you're like all getting all frothy at the mouth. You're like, this is awesome stuff. And I'm like, so describe for me. So you're a neurosurgeon, you're in there, you're cracking somebody's brain open. I mean, you got music pumping while you're doing that, little Guns N' Roses in the back.
So let me take you through a day in the life of me, so
perfect.
I'll wake up probably around like 4 a.m., 4:30, answer some emails, because, everything gets done before OR. So if I have a surgery day, I got to be at the hospital probably by 6:30, 6:45 to sign somebody in, answer their questions, introduce them. Often I'll do the cases with my partner, so I'll introduce them to the partners and then talk to the OR staff. I'll get some light breakfast, and then we'll make incision around 7:30, 7:45. Normally what I do, about 80% of what I do now is back and neck surgery. I still perform brain surgery, but a lot of it is spine now. And, these surgeries can be anywhere from an hour long to 5, 6, 7 hours long, just depending on the complexity of it. And during the surgery, you do want to keep everyone loose, obviously it is a high stress environment. It is something that you're high stakes, when you're talking about neurosurgery, you could paralyze somebody, you could kill somebody. So these are serious things. But at the same time, in my experience, in my view, people just don't work well unless they're relaxed to a certain degree. They need to feel like they're part of the team, but they also want to feel like this is enjoyable. So music is a great way to do it. It's a great icebreaker. I don't really run that. We have a Siri type thing in the OR, and we just say, play top 40 today or play 80s. I'm a big 80s guy, so I'll have them play 80s music a lot. My partners are funny because my one partner, Joseph, is a big reggae guy, but you wouldn't even know it. He's a very straight-laced, serious guy, but,
Right.
plays reggae during it. My partner, Mark McLaughlin, is a big country music guy, so he'll play country music during it, except when he's with me. I tell him you can't do it. And then my junior, like the younger guys that we have, they're playing like some different music that I'm not going
Right. They were not. Yeah.
and
Right.
so so it's a whole wide spectrum. But that's something I tell my guys when we hire them, and I'm like, look, your job is not to just operate in the operating room. You're the leader there. People are looking at you. If you get stressed out in there and you're yelling, you're screaming, you're throwing things, people are not going to be acting at their peak efficiency. You got to relax people from the very beginning. You got to come in, say hi, hello, shake their hand, see what they did over the weekend, talk about their family, make some small talk, just break the ice, because that's so important. And then you can do the surgery. And then from there, we check on our patients. And then when surgery day is done, we tend to round on our patients. And I often have some patients at the end of the day that I'll see. And then back to administrative work. And I'll probably head home probably around like 7, something like that. And, I'll probably meet my kids at the baseball field for my younger kid, or the golf, course with my older child, if it's the summer, and more not because I'm playing, but I'm either coaching or, trying to drive them around and stuff. Right. So, but my partners are good because they'll let me, they'll cover for me on days where I have to do things with my kids. So it's been good.
And how many kids do you have?
I have 2 boys, one 13, one 10. My 13-year-old is going to George School next year in high school, and my younger one goes to Newtown Friends. They're both great. They both are totally different, both sporty, but really, really good kids, real good kids.
Nice. And I was going to say, because you could absolutely tell, and I've been with Nirav when we've been out, and with one of your sons, he joined us, and we've played golf together, and just chip off the old block. It's pretty entertaining. Yeah,
except he can actually play, and I can't.
Yeah. Well, you said that. I didn't say that.
Yeah, well, it's the truth,
Yeah. So I've had the pleasure of interacting with Nirav again personally, but also professionally. You've been an expert for ours on any number of occasions, and so as this is attorney talk, one of the things I wanted to have you sort of share your experiences as a non-lawyer interacting with lawyers. How has that gone for you?
Yeah, it's an interesting thing. When I came out of training and started the practice, I never really understood the medical legal aspect of what doctors do. It's not, we started taking care of patients, some of which were in an injury, some of them, work-related injuries, and then attorneys would contact us to, either, provide an opinion as to what happened, what might be in the future. And initially I was like, what does that mean? I'm not sure what they actually mean. But then, you talk to these patients and you realize what these injuries do to their lives. It's not just the surgery and the medical care, but it's also financially, emotionally, what it does with their family relations. I mean, it is a multi-tiered effect to their quality of life. And that's where I started realizing the value of some of the work that I'm doing in terms of medical legal and the relationships I've developed with attorneys, because the care really doesn't stop with the last stitch. It doesn't stop with, the last prescription. The care is also advising my patients, what can they do from a work perspective, because they got to feed their families, and I'm the one who has to tell them, look, I think you can do this, but you can't do that. Or you're never going to be able to do this again. Or you know what? With surgery, I think you can get back to this. And so part of that, in order to get the care that these patients need, I realize that they often need an advocate. And that's where a workman's comp attorney really has been a benefit that I've seen. Because a lot of the care that I'm rendering can't be done unless it's approved by the workman's compensation carrier, who, I know they have a role and I know they have a job, and, we're not here to bash anything. I think everyone has a role in what they do, but oftentimes they don't get the full story. They don't understand what's going on. And even if I communicate with them, it may not be enough. And having that bridge with the workman's comp attorney, I found as a doctor, actually helps me do my job better. Not because I'm advocating for my patient in any way, but it's more, I just want to get the job done that I need to do for my patient, whether it be, something as simple as ordering physical therapy that was previously denied, to getting imaging, to even recommending surgery. And that is where that relationship with the attorneys has become very helpful, because I'll pick up the phone and say, look, hey, Sam, I think something's really wrong here beyond just a sprain and strain. There's something else going on here. And I'm hitting a brick wall here and trying to get an MRI. I need to get an MRI here. Can you help me? It's one of those things, and of course you're not a doctor, but you're taking what I say and then, advocating for your client, of course. And that's where I think doctors in my position don't realize that the relationship between attorneys and doctors is not simply adversarial. It isn't. Right. It can actually help patient care if it's done right.
And there it is. One of the biggest things that I found from our point of view, and certainly working with you has been tremendous, but that, if we have a doctor, and quite frankly, from my point of view, and we represent mostly, petitioners. One of the things that I've always said is if I get a doctor, even if the doctor says to me, look, there's just nothing more to do, then that is so super helpful to then be able to explain that to a client rather than, oh, well, this doctor is that and that doctor, that kind of thing.
I think you're very, very spot on in that. And that's been very helpful to me, because patients don't want to hear that there's nothing else that can be done. They just don't want to hear it. And they're just so angry about what happened to them. They just can't see past what I'm saying. And so I might say, look, I agree with you. You're injured, but your MRI doesn't show anything I could do anything about. And I can't really recommend anything else because you've done it already. You've done some therapy. You've done this. So then I'll pick up the phone. I'll call Sam and I'll tell him. I'll say, look, I believe this person. I think they're injured, but there's just nothing more I can do. We just need to kind of move on here, and that's where I think, again, bridging that gap, having that attorney. I mean, I don't envy the position you guys are in. Sometimes you're acting as doctors, sometimes psychologists, sometimes whatever. But, it is super helpful for me to have that bridge.
And it's funny because you said that I'm not a doctor. Certainly I am not. But, after 30 years of reading medical records, I play one on TV.
Right, exactly.
I know a lot of the care paths, and I can, and I think I think a lot of my clients might be happy if I actually did have a prescription pad that I could, write.
I totally disagree. I don't disagree.
So have you had the opportunity in your interactions with different attorneys, not so much on a formal level, but how about on the formal level? Like, have you actually had to go to court and testify in front of a jury before COVID, things like that?
Going to court has been rare, in terms of actually going there. I've gone a handful of times just because of my busy schedule. Pre-COVID, probably a little more, but post-COVID, certainly we've taken advantage of technology, and now with Zoom and everything, any type of legal activity in advocating, for what I believe in terms of patient care, can be done and is done. And I am often doing that. Initially, it starts with my medical evaluation, and then I may be asked to write a report regarding someone's condition, and then if there's still contention, providing testimony if I truly believe what's going on.
Gotcha. Yeah. Have you had any, I'll say, negative experiences in terms of your interactions? I'm sure there's like anything else there is, but
I think for me, I wouldn't call it so much negative experiences. I think, you guys have a job to do too. I get it. And you guys are beholden to the rules of the court, and one of those rules is timetables, getting things done at a certain time. And certainly as a physician and a busy surgeon running a practice, I mean, my practice covers all the local hospitals 24/7, so I'm responsible for the clinical activity of my practice, deploying everybody to where they need to be, not just the operational but clinical. I have deadlines to also meet for the lawyers' needs, in terms of reports, depositions. So I find that to be somewhat difficult, to balance, legal activity with my career, as far as what I'm doing on a daily basis. And most people understand that because, as a neurosurgeon, people know that we're pretty busy guys and gals. And so I think they give me a little bit of a rope, but sometimes, you guys are beholden to it.
Right.
And so the difficulty is not so much in being upset or anything. It's just trying to meet some of these deadlines.
Right. Well, and it's interesting. And I should say, just for the record, if you will, you're sitting here having this conversation with me and you're in scrubs because you just got out of surgery. Right.
Yeah.
So.
No, I enjoy talking about it. I love talking with you. I think you're great. And so I'm happy to be here. I didn't get a chance to change. That's the only thing.
No, it's okay. Listen, it adds to the true color of what we're doing here.
Yeah.
So if I got to push on you a little bit, tell me what you actually enjoy the most. I mean, your daily practice, your surgical practice, your management practice, the interaction with clients, patients. What's to you the most fun? Like if there were the ideal day for Dr. Shah, what would that be? I mean, other than being on a beach somewhere and not having to do what we do.
That's definitely ideal. Although I probably just tear myself to pieces because I always have to do something.
Yeah, I know. I'm the exact same way. There's always got to be something going on.
I know you are.
Yeah.
So I would say that the thing that I enjoy most, to be honest with you, is being able to come home and tell my wife and my kids an experience that I had at work that was really cool. Now, that experience may not be saving someone's life. Ideally, I would be saving someone's life every day. That's a great high. There's no greater high. I mean, it really isn't. And, but sometimes, bad things happen and you have to deal with it, and it is what it is. But, when I can come home and tell my wife, look, I did 2 spine operations. I was able to get a couple meetings in with my staff. We were able to come up with some real protocols to, enhance the practice. And then met up with some attorneys afterwards for, a few drinks and laughs and really try to, develop our medical legal line of business. To me, that's a great day. And, being able to tell them, but everything focuses still on patient care. Like I have to have something patient center oriented, like something, either seeing people in the office, operating, whatever it is, there has to be that component. I can't live without that component. That has to be part of it. So people always ask me, you do a pretty decent job of administrating and managing, and, do you really need to do all this clinical work? And I love it. I think it's so cool. And that's the stuff that keeps me grounded, but also credible. If I'm going to be an expert in something, I got to be treating people, So.
Yeah. And listen, that's one of the best things about it is that, one of the first questions on voir dire when we go through that is, do you have a practice? Are you still a surgeon? Are you still doing those things? And to have that, fingers in the pie of what's happening as you go through it. Sure. Yeah. And as well, and I know you've written tons and tons of articles. Your CV has got all kinds of articles, and it always looks like you're staying right on top of
I think that keeps you current, keeps you honest, and then, certainly partners, especially the newer guys, younger guys. I mean, it's great to see some of the newer advances, techniques. I'm learning more.
Well, that was, that's my question. Yeah. So, right. So, so are you, having that youth and we'll call it vitality, right? Great. Well, they don't have kids, so that they have vitality, right?
Yeah. Or they have very young ones that don't require us to, shepherd them everywhere. So dude, I love that. It's great. I'm always, one of our younger guys who's doing a lot of cases with me, he's insisting we use, specialized equipment that the hospitals have purchased it's almost like a GPS or navigation, where while we're putting in hardware in someone's spine, we're actually seeing on a CAT scan in real time how it's being put in. That way it's an accurate, very fast, minimally invasive. You don't have to make a big incision anymore. Those are the things that we're talking about,
Right.
And those are things now we can honestly advertise that our practice is doing. So we're generating a marketing value out of that too.
Sure. That's terrific. Yeah. And it's interesting because, you talk about patient care, for me, obviously client care. And after all these years, I really am one of the lucky ones. I find that when I say I actually love every single day getting up and going to work and doing my job, it's true, because at the end of the day, representing the people and the clients that I represent gives me the opportunity to save somebody's life, in the sense that I'm going to make sure that there's a roof over their head and food on their table and they get paid and all of those things.
I think in medicine, we don't get to see that side. You know what I mean? Like we don't see how the financial aspect of a loss
Right.
affects their lives. You know what I mean?
Right.
And believe it or not, affects their healing.
Right.
Think
Right.
about it. I mean, if you're, there's no income coming in, if your wife or husband has to now go back and do excess work, there's no one taking care of you at home. You're, not taking care of yourself. Hey, I see it, and that's where I think this gives me more of an appreciation. This is it's a different part of medicine. I call this forensic medicine, and
Sure.
so I think that is a separate branch of medicine. It sort of mirrors with trauma medicine. So I particularly am interested in, the reason I'm very interested because I did a lot of trauma work at the University of Maryland. It's a very trauma intensive program. So of all my partners, I do the most trauma. And so I see the most injuries, but I'm interested in that because I'm interested in some of the dynamics, the literature, current events, all that type of stuff. And, injuries are its own category in terms of medicine, subspecialty.
Yep. Well, listen, time flies when you're having a good time. So before I let you go, a couple of things. First off, if somebody wants to get in touch with you, what's the best way to get you? Where can you be found and all that kind of stuff?
No, I appreciate that. Our practice is the largest neurosurgery group in central New Jersey in Mercer County. We have offices in Princeton, and then we have also offices in Freehold, New Jersey, as well as in Flemington, New Jersey, and we're also in South Jersey. We also are in Bucks County, Pennsylvania, in Newtown. Our main hospital coverages are Princeton Medical Center, Capital Health Systems, Central State Medical Center, Hunterdon Medical Center. Our office phone number is 215-741-3141. I know we have a 609 number, but they're all the same. And then I encourage everyone to go on our website, PrincetonBrainandSpine.com. It's all one word, and you spell out AND. I think you'll get to know us a little more. We welcome any patient who has any spine or brain dysfunction, and be happy to see them.
And I have to say that out of all of, or not all of, but quite the number of websites and things of that nature, the Princeton Brain and Spine, the website, it's very user-friendly with a lot of good information. You get to really see who the different doctors are. So certainly very helpful. And I would strongly suggest that if anybody is having any of these concerns, that they reach out for Dr. Shah and Princeton Brain and Spine for sure.
Oh, appreciate it. Thank you.
Well, listen, Nirav, I can't thank you enough. I really do appreciate you joining me here on Attorney Talk, and I very much look forward to this summer so we can get out and play some golf for sure. Absolutely. And but in the meantime, I want to say thank you. Everybody who's liked this episode, please make sure you share it, like it, and all that good social media stuff. And we'll see everybody the next time on Attorney Talk.
All right, bye everyone. Thank you again. Thanks again, Sam.
My pleasure.
You've been tuning into the Attorney Talk podcast, sponsored by Schaeferman Lakin, with your host, Sam Gaylord, disability litigator in the state of New Jersey. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, schaeferman.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.